Well, good afternoon, everybody. Welcome to this third Peterborough Summit, which is called Keeping Peterborough Safe. I'm Wayne Fitzgerald. I'm the leader of Peterborough City Council, and I'll be chairing this afternoon's meeting. So I'd like to welcome you all. Paul Bristow is on the way. He's just going to be 5 minutes late, so the MP for Peterborough. Our Mayor and Deputy Mayor are also invited today and online. And of course, we have many representatives from the voluntary, community and faith sectors, as well as NHS colleagues. So I'd also like to welcome guests also from our business community in the city. You're all welcome. And from all other public sector organisations, as we've all been working together, as I know, trying to keep people safe in Peterborough. There'll be plenty of noises and binging as we go along as people join the meeting. So I don't want to hold proceedings up because I know you've all got busy afternoons ahead. But again, I'd just like to remind you of some housekeeping rules. Keep your microphones on mute, unless you're speaking, of course. This summit is being recorded and will be available on all our social media channels afterwards as well for reviewing and watching again. There will be time for people to ask questions, make suggestions on comment and what they've heard today at the end of the presentation, number of speakers today. But can I just take a few minutes? Sorry to drone on a little bit, but it is important, I think, while for people watching as well, whether it's live or on playback, that we set out why we're having this meeting today. We've held 2 summits in the past, and we're looking at the key issues for our city as we fight the effects of this terrible worldwide pandemic. We all know people who have suffered since it began: illness, isolation, loss of income, or significant events that couldn't be celebrated. When we last met in February, we were in a national lockdown then. The vaccination programme had started, but we hadn't seen its effect. Today, more than 47 million people here in the UK have had a jab, and everyone aged 16 and upwards is eligible to receive the vaccination. You can simply walk in and get this done free, and you don't even need to be registered with a GP. And society is open, although we are asking everyone to continue to do the right thing to prevent further infection spread. Sadly, today, infection rates in the city of Peterborough are still too high, but because of the vaccination, there is actually a clear difference, and I'm sure Joyty will speak about that. Now, far fewer of our vulnerable 60+ age group are getting infected. Back in February, there was little difference. We also know from NHS colleagues that while people who are vaccinated may still get infected, and I have personal experience of that with friends and colleagues myself, it's not generally as severe, thankfully. But we have fewer people in Peterborough vaccinated than the average, and that's worrying. We're 20% behind the rest of the country, and in of the country, yes, and in some parts of our city, that gap widens to 40%. So that's what we're here to talk about this afternoon. And with winter approaching, there's also the flu season just around the corner. So we have to make sure people take all the necessary precautions. Alongside our city-wide work, we're about to start a 3-month push to focus on areas where we're seeing the greatest number of people who are still not protected, to help and support them, not just with COVID vaccinations, but hopefully other health issues as well. So this afternoon, you'll hear the experiences of some people from the sharp end in health and local business and the perspective of some of our communities. Then we need your ideas on what more we can do together to encourage a greater take-up of vaccinations and together keep our city safe. So I'd now like to hand over to Joyty Attry, our Director of Public Health for Cambridgeshire and Peterborough, to give you an update on the current state of the pandemic here in the city, and Carol Anderson, the Chief Nurse at the Cambridgeshire and Peterborough Clinical Commissioning Group, to talk about the benefit of vaccinations. Joyty, it's over to you.
Thank you very much, Councillor Fitzgerald. You're right in pointing out that rates in Peterborough are very high at the moment at 436 per 100,000. That's all ages. And that compares to 330 across England. So we're in a different position to the rest of England and do need to be more cautious because of it. And more worryingly, rates in the over 60s are also much higher than the England average. and they're at 220 per 100,000 compared to 167 across England. And we know now that schools are back, that there is some risk associated with that. School children, secondary school age children, are being asked to test under supervision in school in the first week of school. So they'll be testing twice, and that will detect more infection. So that's a good thing, because a lot of that infection will be asymptomatic in that age group. So detecting that will mean that we can ask those children to isolate and prevent further spread. But as time goes on and school children are back and mixing, it's likely that infection rates will actually increase further. There'll be further spread through children being in school. And there's a risk that that can then have a knock-on impact into their parents and grandparents, where risks are much higher. I think there is some good news, however, and that, as Councillor Fitzgerald mentioned, is that rates in the over 60s are much lower now, this time round, than they were in January. So if you looked at the graph in January, there was little difference between infection rates in all ages and those over 60. Now there's a clear gap between infection rates in all ages and over 60s. And I think that is indicative of the success of the vaccination campaign, because over 60s have been able to access vaccination for much longer than younger people. And we are seeing much higher rates in younger people, particularly school-age children, who have not yet been able to access vaccination. The other piece of good news is that despite the fact that infection rates are not much lower than we saw in January, that they're high, hospitalisation rates are nowhere near the levels that we saw in January. They're much, much lower. And again, I think that's a strong indication that the vaccine is having impact. And likewise, deaths. There has been a slow creep upwards in both hospitalisations and deaths. There's now 13 deaths since the 1st of August. So that's of concern, but it's nowhere near the rate of hospitalisations or deaths that we saw in the January peak. So I think there's some comfort for us to take in all of that information. But there are still risks, as I mentioned, as we move forward. Firstly, from schools being back and school children mixing. I mentioned that earlier. And then the other risk that we didn't have before is that people who were contacts of cases are no longer required to isolate. So we've got a couple of risks there, and coupled with our low vaccination rates, there is a potential that vulnerable people who have not been vaccinated could be exposed to the virus and have a poor outcome from that. And that is so preventable. If we can drive forward our vaccine uptake, harm can be significantly reduced, as we've already seen. We've already seen some of the impact of vaccination: lower hospitalization rates, lower death rates, lower infection rates. If we could continue to push forward and capture the rest of our unvaccinated population, we can make a huge difference to the harm that this virus can cause. Of course, we need to keep on with the rest of the actions that we've been taking as a society and the messaging that we've been giving to maintain social distancing, to meet outside as far as possible, keep washing our hands, keep up the hygiene regimens that we've been following to date. We need to keep that up too, but we can make a real difference in a relatively straightforward way by just getting the rest of our population vaccinated. I shall stop there. I'm happy to answer questions at the end, and I'll hand over to Carol to pick up the baton. Thank you, Carol.
Thank you, Josie. Good afternoon, everybody. As said, I'm Carol Anderson. I'm the Chief Nurse at the CCG, and I'm here representing Jan Thomas, the Accountable Officer, who's on holiday this week. I do hope somebody's going to share some slides for me. If not, I'll carry on talking. But I think, Pippa, you were going to pop some slides up. Thank you. So from a COVID vaccination point of view, just reiterating what Jyoti has said, it is important that we have the vaccination for two main reasons. One, it really does reduce the risk of getting significant illness as a result of catching the virus and from death. But also there is a strong emerging evidence that the COVID vaccination actually prevents those who do catch the virus passing it on to others. And that it becomes effective from 3 weeks, even after just one dose. So it is really important that we do continue to promote the vaccination programme. And even with a huge and strong take-up of the vaccine in the population, there will always be some small members of the population who cannot have the vaccine for medical reasons, or for those who have been vaccinated, the vaccine won't be as effective as it is in the rest of the population. So this virus is something we're going to have to live with, and therefore the more of us that do get vaccinated then can protect those who can either not get vaccinated themselves or have a low response to the vaccine themselves. And that is the safest way we have to protect our local population. So I just thought I'd share a few highlights with you. I don't plan on reading everything because I'm conscious of time, but we have in the Peterborough area specifically delivered 394,000 vaccinations. As Jyoti indicated, that isn't where we need to be. We do need to make sure that we continue to target those people who, for whatever reason, are hesitant in coming forward for the vaccine. It very much is a system response to getting engagement on vaccine uptake. No one organisation or no one person can do this in their own organisation, and it is really important that we start to think about what really is the barriers of vaccine at a local level, and how do we make sure we do a targeted and focused approach so that people living in that area are really confident in the way the vaccine works. Thank you. Next slide. To that end, people live in one area and can work in another. So I thought it was important to share with you where all the vaccine sites were across, not just Peterborough, but also in Cambridgeshire, because for some people it might be easier for them to go and get their vaccine while they're at work, and they might not work where they live. For others, clearly access local to home will also be important. So that slide just demonstrates where all the vaccine sites are across Cambridgeshire and Peterborough. You can book the sites either via the national booking system, via the 119, or via a local booking system via the local GP. Equally to that, all sites now offer a walk-in service as well as a booking service. And we are continuing to look at how we use things such as pop-up vaccine centres and the vaccination bus to really target local communities that cannot get to any of the centres that already exist. Thank you. Next slide, please. So as Jyoti indicated, we do have a place to go on people remaining to get their vaccine. I've just broken it down into primary care networks. Primary care networks are groups of practices working together locally to deliver the vaccine programme. And as you can see on there, in some instances, there's still 60% of the population that we need to target to get their vaccine. So for Central Thistlemore PCN, that is Thistlemore Surgery and Central Medical Surgery. So we really do need to target those areas and understand why people are hesitant to come forward for vaccine, and help give them the information so that people can make a proper informed consideration about getting vaccinated. Next slide, please. We've also broken down according to ethnicity for why some people are getting the vaccination more than others. And again, you can see for some of the ethnicities, they're a much higher percentage than others. And that just helps us do that really focused work with local communities and local community leaders to understand some of the drivers and some of the things that will help people make a decision to get a vaccine, and that could be about what's in the vaccine themselves, or that could be much more practical, like actually I physically can't get to a vaccine site. So I think it is really important that working with local community leaders, we understand lots of this information we have about why people aren't taking up the vaccine. Next slide, please. So with that in mind, there's a constant group working on vaccine confidence promotion. And like I said at the beginning, it is a complete system partner group with local community leaders, as well as clinicians, as well as local authority partners. We are really trying to do a push in Peterborough to encourage vaccine uptake. You won't be surprised to see the big plan for a central and Thistlemore primary care network, given that there's still a lot of the local community there who have not been able to have the vaccine for whatever reason. All of this is going to be supported with strong clinical and community engagement, because it is really important that our local population are confident in the vaccine. This will encourage them to come forward. We also need to make sure that the sites that we have are consistent. One of the feedback we had from earlier on in the programme is that people were just getting used to the site being there and perhaps we moved it. So a lot of the work going forward is around ensuring that the site where people can go for a vaccine is consistently placed. And there is also going to be in the Peterborough area a big push working together with the local hospital on how we increase vaccine uptake of local pregnant women. We're working very closely with the midwifery services there, and we plan on co-locating the vaccine bus at the antenatal site so that women can have the conversation and make an informed decision about vaccine, and then make it easy for them to access the vaccine. Next slide, please. I just thought I'd share with you some of the sites that are available for next week. And again, given that not everybody will want to access the vaccine where they live, some people might want to do it where they work. I've shown you that across the whole of Cambridgeshire and Peterborough. Thank you. Next slide. We are having to plan for phase 3, which is the booster vaccine. There are some things we do know, but there are still some things that we don't know, and we are having to make an awful lot of assumptions. We are awaiting the joint vaccination national group to tell us what the stages will be. We're assuming they'll be very similar to the previous phases, and we still don't know at this stage whether there has to be the 180-day gap or whether we can do some co-administration with flu. That being said, we're not waiting around to hear what comes out. We're planning in advance, and we'll be able to tweak those plans with a view of going live on the 20th of September, assuming that the national guidance flows in the timeline that it's expected to. Next slide, please. Sorry, that was a very quick tour, but again, I'm happy to take any questions. Thank you.
Well, thank you very much. I think, Bernadette, you've got your hand up there, I can see. So you're the only one I can see at the moment. So Bernadette, do you want to ask a question?
Yeah, thank you very much for giving me this opportunity. Thank you, all the guests over here and the members of Peterborough City Council. As a community connector and also a community leader, there are certain barriers that we've come across, but some of us are not clinicians. Some of us are just, people trying to help people to try and get the vaccine so that we can kick out this pandemic that is affecting everybody. Some of us have also been victims. In the local areas, we're talking of barriers, and we've been given data according to, could be localities and things like that. And then on the other hand, when you hear things, any communication like in the media, they say the opposite. Like if you take a place like Central Park being put top of the area with a higher rate. But if you check the residents that live there are predominantly white, and yet we are talking about other ethnicity. Is it just a data that people who go there, or is it data that has been taken for people actually living there? But if it is so, then we need to be working also with the white British try and make sure that they're taking this vaccine. If we are talking about localities, Central Park, I work around Central Park. I've done lots of events there, so that's why I know the areas of the people are there. My next question is booking, which could be a barrier. I'm sorry, I'm gonna say them all. The booking, when you call 119, at times I think that you can really be frustrated. One, they're not really user-friendly to the community, and especially if English is your second language, you will be lucky if you go through. You might be told to try later. So that is something that needs to be looked into, because it falls back to the community leaders to try and make phone calls for these people. I really like how the CCG is working really hard to bring up the pop-up vaccine centers, of which I've also worked through to try and lure people to get the vaccine. It is something that is very useful, I think. And when we were there were some people who just passed by there on their lunch, and only to find that they're able to do that vaccination because they've done like 8 weeks. That was something that helped them, because some people work in shift rota, that by the time they think of going to a city care center, which finishes at 3 p.m., it's not easy for them to get that. So some of them, it's not that they are refusing, it's they have to go to work and they need that. So the bus is helping them, but some people also, when they see the bus the first day, they kind of think it is gonna come the second day. So I don't know whether you could do 2 days in a place. I'm conscious of the time. So another thing is transport. Most people cannot get transport to those areas, but the communication, just the other day I had in a meeting, I might be wrong, that there's transport or bus fare that people are given or something like that. This communication should be going out there so that people know, so that we can be able to actually tell the communities. It's not there in the community, it's not there in the grassroots. And then that fear of having the vaccination, that's my last question or comment. And many people might have a fear. Everything is new to most people, but you find that it's very difficult to get a clinician or a professional on site to be able to explain to you. Some of us are put there like COVID connectors to bring people in. They ask us questions, like a pregnant woman came and said, I've been told by my community, what they call community health worker, not to even have paracetamol. How come now I'm being told about the vaccine? We have the nurses there. We then tell them, go to the professionals who are there. But already they have people there who they're giving the vaccination to. Why don't we kind of have, I'm just thinking, a pop-up a place where clinicians can answer those questions and help these people who are ready to could be have it, but they just have the fear of the unknown. And some of them think that, oh, if you take Moderna, your fertility rate will be okay. So these are questions that are out there. And also because of the conspiracy theory that are out there, it would be nice if we have some clinicians at those pop-up places, or a place, because the GPs are not opening their places to even answer questions. To get a GP is very difficult. Thank you very much. I'm sorry I took your time, but I thought I would say that.
Okay, Bernadette, thank you. I don't know if you want to answer any of those questions in Carol, so, or you may want to, if you want to answer them quickly, or you can give Bernadette, you can watch it back and answer in detail, because I know some of the questions she's already asking are in place already, but I think, Bernadette, perhaps it needs to be shared with you more widely and others more widely. So I know that information and some of the things you're asking about is happening. So Carol, if you want to have a go at answering some of them, I'm just conscious of time, or do you want to respond in writing to Bernadette?
So shall I do both, Councillor Fitzgerald, and just do a very quick response to some of them?
Very quick, yes.
Yeah, so thank you, Bernadette. Really helpful questions. The data that's used is the people that are registered with that GP. So you're right, it's all different populations. So we need to target lots of different ethnicities and not just focus on one or two. I take your point about the pop-ups, and we're trying to make sure that they're in more consistently in the same place, because we have definitely learned from people that they prefer that. It is driven very much by the workforce availability as well, Bernadetta, but certainly we're trying to make them better. Fear of vaccine, there is a clinician in every vaccine site, whether it's the bus or whether it's a pop-up or whether it's a pharmacy. And we are changing the way people can access. So if people just want to walk in and ask some questions, they're very well and entitled to do that, and they'll get a great response from the clinicians there. They don't need to book an appointment. They can just walk in and have that conversation about should they have the vaccine. And I'll make sure I give you a fuller answer outside of the meeting for the rest.
Great, thank you very much. And all the questions that if you've got, and we don't get time for you today, I would urge you to email any one of us, and it will get passed on to whoever you want to ask the question of, because I know I've got a couple of questions, but I'd like just to change my agenda slightly, if I may, and ask you to bear with me. So, because Paul Bristow MP for Peterborough is on the line. I think he's got a question. I hope it's to himself. And secondly, I know he's got some time pressures at the other end of the hour. So, Paul, I know you've been across this issue and you've made some very public statements in the past. And I know you'll continue to fight the cause for Peterborough. So do you want to make some remarks now? And if you do have a question of one of our speakers so far, put that now.
I will, Wayne. Thank you very much indeed. And I'm not going to bore everyone with a lengthy speech. It's just a couple of comments and then some questions, if I may. Just first off, I just want to say, you know, I wrote to the council and the CCG, and as I said, we needed to do again something like this. And so I just want to say thank you for organising this meeting. It's absolutely excellent. I also want to thank the council and the CCG for their leadership. And although the national stats don't look great for Peterborough, I know, and I'm sure everyone on this call knows, what a marvellous job you've actually done rolling out the vaccine. It's been an incredible achievement, and I know how hard everyone's worked. And I just want to place on record my thanks. I also want to thank everybody from Peterborough in generally, the whole city, the community leaders, etc. Because I know we've all been in, to coin a phrase, we've all been in this together. And I think you've all worked incredibly hard to sell the benefits of the vaccination programme and some of the public health messages. So thanks very much. We often thank our nurses, our social care workers, our doctors, etc. But I think all of you deserve a special shout out and a special thanks for getting us through this. I know how hard you've all worked. Just a question first and foremost from the presentations. I'm really grateful, by the way, for the presentations. That's the first time I've really seen in black and white who is not getting the vaccine and where do they live. I've often seen the geographical, but the first time I've seen it in a demographic way, and I think that's helpful. We need to understand who is not getting the vaccine and then ask the questions why. And I saw that within central Peterborough, you're placing a lot of faith really on Thistlemore surgery and what they can do. So I'm just wondering whether you might want to go into more detail with what that outreach from Thistlemore practically looks like, because I'm sure everyone on this call will be keen to help and assist you with all of that, and myself included. Just some comments. I mean, we've got to remember, I think, in Peterborough, that we've got residents living in our city that in living memories have lived in states with governments that have not been benevolent. You know, we've got lots of Eastern European residents in our country who lived in living memory under socialist, communist dictatorships who, you know, were not benevolent governments. That goes even further for refugees and asylum seekers and more recent arrivals who are, again, living under governments who are we're not traditionally going to be trusted. And so we've just got to remember that, and not arrogant enough to assume just because you know, we're in charge, the state's in charge, people will trust us, because that's not been their lived experience. And so we just got to kind of remember that. Social media, a lot of these difficult to reach communities are also those who are most prone to disinformation on social media. They don't access mainstream media in perhaps the same way as some other communities. And again, we've just got to be kind of aware of that, and I'm sure we all are. And so because of those two things, they're going to have plenty of questions and plenty of engagement. And rather than using a stick, it's using the ear and listening and questions and answers. So we just really need to think. And I'm pleased of what you've said, Carol, about people being available in clinicians to answer questions, etc. But I think we need to also get those people outside into the community to answer those questions too. So that we need to see them, you know, we need to see them publicly as well, because these are influencers, and we need to get those out on social media and everything else. Just on Bernadetta's point as well, actually, I think she made a very important point. Is a lot of our Peterborough's a working city. Whether you're from whatever community, you're in a working city, and many of the residents of our city, you know, they work, they eat, they sleep, and repeat. You know, there isn't, you know, that kind of bandwidth or that sort of time to actually go out and do other things, especially socialise. let alone go and get a vaccine. So, we've just got to understand Peterborough's a working city, and that's going to have some challenges. And so I was just wondering whether any thoughts really been given to these transport issues. I saw a lot of taxi companies were at one point offering either free taxi journeys or discounted taxi journeys for those to engage, for those going to get their vaccination. I'm just wondering whether the local authority or the CCG might want to actually contact some of our local taxi companies and say, look, is there anything we can do in partnership together to try and get, kind of people from home to the vaccine centre and back again? Because I said, the time poor, it's work, eat, sleep, repeat. So I just think that's a really good point that Bernadetta said. And, and on this idea about going out into the community, is there anything we can do? It's maybe a madcap idea, at least half my ideas are madcap, but I'm just wondering whether, can we go door to door? Have we been going door to door with members of the community, with medical professionals, and just asking questions about why? Have you been vaccinated? And if not, why not? I think just kind of waiting for people to come to us is no longer an option, quite frankly. And look, I'm very willing. I mean, we've just said, by the way, that a lot of these communities don't trust, their governments or central government in quite the same way. That trust probably drops by another 50% for their local MP. But I'm really, very, very willing to go, door to door and do anything you think would be useful to try and get this our vaccine up. Because the last thing I really want to see is, we said this opening up is going to be irreversible, and I'm holding the Prime Minister and the government, to that. But we can't be complacent, and I don't want to see a situation where Peterborough's locked down because we've just not got our population vaccinated in the appropriate level. So those are my kind of comments.
Thanks a lot, Paul. Just like Bernadetta, a lot of the points you raised, the team here in the background are telling me is already happening in many cases. So there are transport links. There always have been door to door, but there's a redoubling of the effort on that starting on the 17th of the month in order to, hence one of the reasons for this meeting is to, double down. When I was asked about what are we doing, it was to double down on our efforts and revisit that no stone unturned. We like to say quite here, often in the council on a number of fronts, but this is definitely one of them. So I think what we've determined or decided to do for everybody's benefit is Christine Birchall, who's in charge of comms, is making notes of this meeting and all the points that are being raised. And I think those that are contributing, we should summarize and capture the answers to those questions. So that Bernadetta's raised, Paul, you've raised some, just so for reassurance alone that actually some of those things are already happening, but you need to know they're happening, where there are buses, where there are vaccine centres, clinicians. And I think it's good to bring all these things out into a public forum and then, capture that and share them all with you so that you are up to speed and everybody's on the same page. Now, listen, I don't want to dwell too long. So there are two people wanting to ask questions, but I will take the questions and we must move on. But Abdul and Moaz, if you could be brief, and Abdul, you're first, if you want to pose a question on something you've heard so far.
Thank you very much, Chairman. Just a couple of points. First of all, I'm still sad to hear this. There is a low intake of British Pakistanis on the vaccine, although we have requested many times to give us some facts and figure about that one, which never received on that one. My second question is the involvement of the community leaders. Now, we've been asking the power to be for a long time that our mosque, which I represent as chairman of Joint Mosque Council, has about 20,000 community members in our different mosques. And on Fridays, we have about at least 1,000 in Fazan Medina Mosque alone. And we offered our facilities that they can use our mosque, our car park to get the vaccine done. But to cut short, after a long time, we had that one, our facility being used on 3 consecutive Fridays. I'm pleased to say that one, during a 3 weeks period, we had several hundred people who took up the vaccine. Now, I request at the same time that you can carry on for a longer time Doesn't have to be just 3 weeks. It's a benefit to the community, and people are not only from the worshippers, but even the surrounding areas, as you know yourself, Chairman. The central mosque, Fazanamdir Mosque, in the middle of the central area, and there's quite a few other people as well who can benefit and did benefit. But unfortunately, despite our request, nobody had come back to us that they would like to carry on using our mosque facilities for a longer period. And the same was the case we asked for other mosques, Asani Islamic Center in Burton Street. They offer the same thing. So our facilities are still available if they want to use it to get the vaccine done, and we are there to help. And that's what I have to say.
Thank you, Abdul. Always a pleasure to hear from you, because I know you represent a section of the community that we are having difficulty reaching. And there may be some, things that we need to push further forward in terms of, like other areas, in terms of are doing to try and encourage people to get the vaccine. But we won't do that in this meeting. I'm trying to be as quick as I can, folks. So Moez, I'll take your question and then we'll move on back to Jyoti to introduce some of the speakers, because I don't want to be too long behind our schedule this afternoon. Go on, Moez.
Thank you very much, Councillor Wayne and Chairman. Just my suggestion is about the booking appointment. This is that I feel that this is the key that people not using the service, because you maybe wake up one day, they are very well, so I'm going to take my vaccine. When they come to the booths, for example, they say, oh, you didn't book the appointment, so we need to book your appointment. So sometimes people is discouraging the booking appointment. So if we can remove the booking appointment and put the drop-in session, so anybody in coming to the town, for example, has good mood and has coffee in town, sometimes refreshes his mind, there is a dropping on the vaccine session, that it can be worked very faster rather than booking, because booking is taking maybe 2 minutes, maybe 5 minutes of the person, and the person may change their mind straightforward because the booking system, date of birth, nationality, whatever, what is it, that is causing people stressing or taking or not taking. But when it's a dropping, it's totally different way. Thank you.
Thank you, Moez. Again, I'm just getting comments in the background that there are plenty of drop-in sessions available, but maybe we need to do more or look at again how we're advertising those and how people in the community, everybody on this call, can make sure that we can promote the availability of those sessions. And also, particularly with mosques, just like many other places, mosques may have to start to think of restricting access, just like many other areas of society are doing, unless you can show evidence that you are vaccinated, because you don't want to put yourself at risk or other people at risk. And I would just leave that thought out there, because it's something that perhaps people need to consider within communities where there are large gatherings, and to encourage people, not to punish people, but to encourage people to get vaccinated because it's the right thing to do. Jyoti, if I may hand back to you now, we'll carry on with the agenda. So Jyoti Attry, our Director of Public Health for Cambridgeshire and Peterborough. Do you want to pick up where we left off, Jyoti?
I can do. Thank you, Councillor Fitzgerald. Next, we've got Dr. Kanchan Reggae, who's going to give us the perspective from the hospital's point of view. Dr. Reggae is Deputy Chief Executive and Medical Director for Peterborough City Hospital. Thank you.
Thank you very much. Can you hear me? Yeah, okay, great. So I'm Kanchan Reggae. I am the Medical Director here at Peterborough City Hospital, part of North West Anglia, which also runs Hinchinbrook Hospital. So since the beginning of the pandemic in March 2020, we have had patients consistently in our hospitals every single day. At the height of the pandemic in January for us, we had 342 patients and nearly 45% of our whole bed stock was taken up with COVID patients. Our lowest number has been 2 patients. We've never gone to 0. Currently, over the last few weeks, we've had about 55 to 60 patients in our beds, and 45 of those have been in Peterborough. Of those 45, approximately a third of the patients have had the full vaccination. So the other 2/3 have not been vaccinated or have only had one vaccine. So as has been mentioned, the deaths are certainly fewer than they were, although we did have 3 deaths in 1 week a couple of weeks ago. But when people do get ill, they still need ventilation. So it's still a very intense experience for them, and it's dangerous for them. I just want to make the point that it's not just a decision about the individual, about the repercussions of vaccination. So if patients get COVID and come to hospital, there are very wide-ranging effects. So the more patients we have in the hospital with COVID, the more likely they are to pass it on. Even with the best infection control measures in the world, there is a risk. And when that happens, we have to close beds to prevent further patients and staff getting infected. And when we close our beds, it means that our emergency department gets very full, and it means that we have long ambulance waits outside our front door. And that has a huge effect on ambulances being able to collect people who are acutely unwell from the community. So there are large knock-on effects. The other thing we have to do when our beds are very full or not available is cancel operations. So almost in an unheard of fashion, we've had to cancel a lot of our elective surgery recently. We just don't have the beds to admit people for the operations that they've been waiting for, such as their hip replacements and so on. So I would really be very happy to join forces with anyone on the call about spreading the importance or highlighting the importance of vaccination. I have doctors who come from a variety of backgrounds and ethnicities, and I know that they've already linked in with some community groups to try and be that expert clinical advice. We have more than 80% of our own staff vaccinated, and as Mr. Bristow has said, the hesitancy does tend to be ethnic based, in the sense that people have a lived experience of suspicion in other countries, and that plays out in the hospital staff as well. But nevertheless, we've done our absolute best, and our rates are pretty good, I would say, actually, in hospital. So that's where we are. My point is that a decision not to be vaccinated has wide-ranging ramifications for many people's health, not just the individual.
Thank you, Dr. Cunchen. I suggest we hear all the speakers, and then I'll hand back over to Councillor Fitzgerald to chair the rest of the session. So next we've got some speakers to give the perspective from the business sector, and they're going to talk about the impact that COVID has had on their business and their staff, and the steps they've taken to protect their staff. First, we have John Edgley from Pioneer Foods, and he's the Health and Safety Manager there. Thank you.
Thank you, Josie. Right, so some of the problems we've been having, it was about 2 weeks ago, we had a massive surge in cases in the factory. This wasn't actually caused by, or it wasn't caught by people in the factory, it was actually from the outside local community. We do a very extensive track and trace system here, which we're continually adapting. So we have the track and trace, which I'm now on version 10, I think, of the form and the system. The problem was people were going and mixing in the local community, going to pubs, etc. when they opened. And because of the low vaccine uptake, obviously they were feeling the effects of it and catching the virus. So as I say, about 2 weeks ago, we had this problem. I then approached the staff individually. We have 400 staff on site. So I've been very busy going around talking to groups of 5 to 6 people, socially distanced, of course. And we've been delivering a little speech and a little sort of one-to-one session, so to speak, on what is their understanding of the vaccine and why haven't they uptaken on it if they haven't. If they have, would they feel free to spread their story of when they've had the vaccine, what it felt like, have they had any side effects? We've found this has worked very well in the factory, so the word has spread across the factory now. So we've got more people willing to take the vaccine and actually coming to me for details of where they can do that. So I'm happily passing these details on. I've created a vaccine information centre downstairs, so everybody can visit that and see where their local vaccination centres are. We actually give them the information they need and help. We work with translators if they have trouble with understanding, so the translator can deliver the information to them. We do have a few people from a few different ethnicities, so we're always trying to find new ways to deliver this information. But my feeling now is that over the last 2 or 3 weeks since we've started this, there's a lot more people willing to uptake on the vaccine. So I'm always open to new ideas, obviously. So if anybody wants to contact me and help, that'll be great. And I'm very interested in things like the vaccination bus and pop-up vaccine centres, willing to give up our car park to house either one of those. If we could do that, we're open 24 hours, so we could provide that service 24 hours if it's available. I think I'll pass over now to the next person because I think I've taken up enough time.
Thank you so much, John. Some great work there and success you've had, and some great offers too. Thank you very much.
Thank you.
If I could introduce Hannah Gagan and Richard Gutzel from Coloplast. Hannah is Head of Government Affairs and Patient Advocacy, and Richard is Director of UK Distribution. Thank you. Hannah, please.
Hi. Good afternoon, everybody. Can you hear me and see me okay? Great. Okay. First of all, thanks very much for having us on this afternoon. It's great to be with you all. And thanks, John, for introducing some of the issues that you've been having. So firstly, I'd say, like many of you business people on the call, we employ a large amount of people from the local community. As a responsible employer, we take health and safety very seriously, as you can imagine. We've continued to take precautions, temperature checks, sanitizers, increased cleaning, face coverings. But we believe we still have a population of our workforce that isn't vaccinated. Of course, due to employment law considerations, it's difficult to ask for vaccination status information or to insist employees are vaccinated, as been discussed already. We've already purchased flu vaccination vouchers for the autumn and have booked 2 days on-site flu vaccinations for November to support our employees to stay well. Of course, with the distribution centre, it's critical. We're a critical business to stay open in that sense. Our distribution centre cannot work from home. Therefore, vaccination is important for us to continue to be a successful part of the NHS supply chain. So kind of as John is saying, as others say, we would welcome even more guidance and help from the council and local government on how we can continue to keep our staff and community safe if cases begin to rise again. So again, very brief, and there you go. Thank you for having us today.
Thank you. Richard, did you want to add to that? Hannah, is Richard with us?
Sorry,
Richard,
nothing from me. Hannah covered everything.
Okay, great. Thank you very much. And then finally, we have the perspective from the community sector, and we've got Petra Torak to give us the view from his part of the world.
Thank you. What I can add to the conversation is that we have been for the last 3-4 months now working with mainly the migrant Roma communities from Czech Republic, Slovakia, Romania, and some other countries, but now also expanding to other migrant communities with the view of actually tackling some of the misinformation that is still out there on social media. Especially when we talk about Roma community, the main reason why Roma people don't want the vaccine, as probably many other people, is because the hoaxes on social media. Because Roma can't speak English well, they will get the information from social media, and they will believe that it's it's going to be controlling people through microchips, that people will die eventually because of the vaccine, and loads of misinformation that is out there on social media. We've been commissioned to do some quite in-depth work, especially in Kent area by NHS, because again, there was a big disparity between the vaccination of other community groups and Roma. And we have identified some ways of actually tackling those misinformation. We have created a pool of ambassadors within the community to talk about the vaccine. We have created also a helpline, 24/7 helpline, where people can call in and ask any questions about the vaccine. But I would say from our intelligence from the communities is most of the people are considering vaccination purely because of traveling. And I think what also will probably have an impact on getting people vaccinated is the proposed change to legislation, obviously, to allow people to large gatherings only with vaccination. So that might change. But otherwise, with the Roma community, it's going to be a hard case to break the kind of mistrust as such.
Thank you so much. Really good to hear the efforts that you're making, and others have contributed some really good examples of things that we can all do to try and drive forward vaccine uptake. I'll hand back over to Councillor Fitzgerald to chair the end of the meeting. Thank you.
Thank you, Joyce, and thank you to all that have contributed today for your time and efforts. It is appreciated, and everybody is trying to do their best. As I say, we're capturing all the comments, and any questions that arise will be circulated around to everybody. But also, don't be afraid to write in or email in with any suggestions or thoughts that you might have after the meeting. Even now, we're just, sitting here listening, and we're talking about, what's important to people. And in all honesty, getting double vaccinated and going into a pub or a church or a mosque or anything else is only important to you when it affects you. We were just debating here a moment ago about how important it is for young people, they say, according to a survey, about travel. But believe me, when they're stood in a pub or a queue for a pub and 8 of them can go in and 2 of them can't, I think they'll still see the difference. So we've got to use every tool and mechanism possible, whether that's, in employment or in social or leisure circumstances, in order to drive the rates of vaccination up, because you've got to come back to where we started today and look at that chart that was presented earlier about the vaccination rates in the city. It's quite clear to see, and you'll be able to pause that on replay if you want to have another look at it, see how does that affect you? How can you influence within your own communities or elsewhere in the wider community across the city to try and get us up and get us out of the bottom? So look, anybody that hasn't spoken, there's a few minutes, so I will invite questions. And I noticed Gary came onto the call and he's popped up on my screen. So Gary Howsam has joined us as well. So, but if anybody has got any questions or anybody else wants to speak, anything that's not been covered, or you want to get to the bottom of something, it is now speak now or forever hold your peace, I think. So I'm opening the floor to questions or any other speakers. Deathly silence. Gary, you look like you wanted to say something.
I'm really sorry, Wayne. I was trying to get into the wrong meeting when I jumped out of surgery to join you. I hadn't got the new link. I'm quite happy to say nothing, but if you want me to give the primary care update, I'm happy to do that. It's your call.
So Gary, well, we covered a great deal of things today, but yes, it might be good to have we've heard from the hospital perspective. So if you've got a couple of minutes by way of an update in terms of what's happening in communities, that might be useful for everybody.
Okay, thank you. So for those I've not met before, I'm Dr. Gary Howsam. I'm the clinical chair of the local commissioning group, but I'm also a GP in Peterborough over at the Nene Valley practice. I did catch the tail end of what Kanchan was saying about the pressures on the hospitals. And I think that's reflected right across the health and care system at the moment. As I say, I've stepped out of a surgery this afternoon, and they say the safe limit is somewhere around 30 patients a day. And I sort of had interactions with about 35 this morning, and I've spoken to about 15 this afternoon, and I'll have another 15 by the time I get back into surgery. And it's really a mix of several things. We've got the usual stuff we'd be dealing with in general practice. We've also got a large number of people that are sitting on waiting lists whilst they're waiting for their hospital treatment, so they need ongoing management. We know how busy our hospital colleagues are, and patients are being moved through the hospitals as quickly as possible to allow more people in. So that means there's more to look after in the community once they've been discharged. And then we've also got the changes in the ways we're working, meaning we're doing a lot of work more remotely, which is because we're working to mandated infection prevention control. And although other buildings in the community may well be open, crowding sick and vulnerable people into a GP surgery isn't safe. So we're doing as much as we can. And then the last thing we're dealing with is probably the lowest morale I've seen across our teams in the last 20 years, because the level of abuse that our staff are getting at the moment from frustrated patients is quite dismal. And that's in individual cases, but also in the media. It's just our turn at the moment to be being slammed for not seeing people face to face. We know that we're seeing more patients than we were seeing the year before the pandemic. We're doing 11% more consultations. We've got 35% more admin and bureaucracy to be dealing with. And we know that we've got less GPs now than 2 years ago, despite the promises of 6,000 extra across the UK by 2024. So less of us doing much more, but doing our best. And I guess the message is out to the community is please be kind to anyone that's providing with health and social care at the moment. They're doing their absolute best. I don't know a single person who's not working beyond their contracted hours, whose mental health hasn't been impacted by the stresses and strains of the job over the last 18 months. And if you break health and care workers, you break the system, and that's the worst thing that can happen for our communities, because they're reliant on the moment. And I know Kanchan would say this for all her staff, and I'll say it for everyone in primary care. They've done a fantastic job. I know we're focusing on those that haven't been vaccinated, but we've done over 1 million vaccinations across Cambridgeshire and Peterborough. And, you know, the fact that staff are being spat at, abused, premises vandalised and denigrated in the press is totally unacceptable. Sorry, that's supposed to be a talk, not a rant, but you've got me when I'm busy. So thank you for listening.
Gary, there's always one thing you can be relied upon is passion. So you always speak with a great deal of passion. Thank you for your words. We've got a couple of questions to get through quickly, and then I think we'll wrap it up. So I've got Ranjit second, but first in the queue was our Mayor of Peterborough, Councillor Stephen Lane. Steve, do you want to take it away? Ask your question?
Yes, and very quickly, I'd like to applaud the comments on the work being done by the business and community sectors, and a special mention for John, I think it was, and then Abdul earlier. But can we, or it's probably already been done, like a lot of this work today, Wayne, can we encourage our business community or reach out to them, either through the Chamber of Commerce or whatever, to replicate some of the work that John and Helen are doing within their businesses? Thank you.
Thanks, Steve. I'm sure that'll be noted by those that are listening. Yep. I'll try and squeeze in Bernadetta as well, if she promises to be very, very brief. Ranji Reddy was next. Ranji.
Yeah. Good evening, and thank you, Chair, for organizing the summit. I'm Vice President of the Bharat Hindu Samaj Peterborough and the Secretary of the Peterborough Diwali Festival Committee. Now, this is a busy season for us, and it's very worrying because we are trying to put the COVID precautions in place in our community, and we are trying our best. And we are also going to organize a big event next month, the Peterborough Diwali Festival, following all the COVID guidelines. And my question is to Dr. Kanchan. She said 1/3 of the people who were double jabbed, because in our community, there has been no resistance to vaccination. And what is the age group which was likely to get hospitalized when they were double jabbed? Is there any higher incidence in a particular age group, or is it just a general mix of all ages?
Thank you. It's sort of the older age group because they come in with other illnesses as well. So we test absolutely everyone as soon as they come into hospital to find out whether they've got COVID, because we have to look after them in a separate side room and so on. So they may be of all ages, but the people who are getting ill tend to be the younger ones, actually, because the Delta variant is quite virulent.
So it's below 30, is it? 30 years?
Not below 30, lower. So during the height of the pandemic, we were really talking about people in their 70s and 80s. It's a much lower age group than that.
On the 50s, yeah?
Yeah, exactly.
Okay. Because I could convey the information and say, you people be safe and wear the mask and keep up to social distancing.
Yeah, absolutely.
Yeah. Okay, thank you.
Thank you. All those things apply. Now, Bernadetta, you have spoke once already. But if you swear hand on heart, be very, very quick.
This is another Bernadetta.
You will be the last question, but
yes.
Please keep it brief, because we are at time now.
Yeah, it will be 2 minutes. We've spoken well about vaccination and everything, but we need to get more information on when it happens that somebody has got COVID and others have got to self-isolate. And they're being told about the government grants and things like that. It's not very clear when you start applying them, and the community are still coming back to be helped, because there are others who are not on universal credit, or they're not on benefit. And most people, the first thing that comes is benefit. Already those people on benefit are being helped, but as people on zero contract are not being helped anyway if that grant is put in that way, because it's very, very difficult, the process. Thank you. I think I was 1 minute. Thank you, sir.
Yes, you get a gold star for that, Bernadetta. Again, if there's an answer to that question that Christine can tease out of somebody, I think what we'll do it in the wrap-up notes that will be circulated to you all, and then you can disseminate that amongst your friends, colleagues, communities, and wherever you feel appropriate to signpost people to look. But it's been a great summit as well, a lot of contribution. But can I just ask you all, through your respective channels, to double down on your efforts to try and drive up the vaccine rate in Peterborough, protect yourselves, your families, your loved ones, and everybody else around us, because I don't like it when we're in the news as being one of the worst places in the country for it. And there is no need, but we just need to, destroy the myths, encourage people whichever way we can, carrot, stick, whichever, to try and get them to take up the vaccine. So I'd like to thank you all for your time today. Thanks to all the team for organising this third summit. I'd like to say I look forward to the fourth, but to be honest, I'd rather not be having any of them, because I'd like us to be well clear and, in the top 5 best performing vaccinated cities throughout the world. But I'll remind you all that this meeting has been recorded and will be available on the Council's YouTube channel and other social media channels from this coming Monday. So may I wish you all a good afternoon. Have a good weekend until we either meet again in person. Take care for now.